So Marg, when and where did you start your social work practice?
Well, I actually began in St. John, New Brunswick, at mental hospital. The Lancaster Hospital it was called. And from there, well, actually, I was out of work for some time because of children. And then did only very, very part-time work for a short period of time, about 4 years. And then I started at the rehab center, and that was 1982, I believe, when there was a move from the ROH building itself, that site, to the new rehab center. And so I was in rehab from then on for 19 years.
Okay, so can you explain what your primary area of practice was?
Well, at the rehab center, the social worker's role varied depending upon which program you're in. And the initial program that I was working on was the adolescent program. And with the adolescent program, although we did outpatient work with young adolescents with physical disabilities, we, through the year, we had this 2-week course for them in the summer, and so much of our time was spent in preparing for this 2-week course. And as the social worker, I was one of the first to work with the doctor to set up that program. And then afterwards, other professionals such as the psychologist or the physiotherapist would have a section of that time to work with them. And we also spent a great deal of time with these young people, not just teaching them, but also on outings and just being friendly and socializing with them. So that I was in that program for quite a number of years. And I think about the last 4 years that I was there, I was then on different programs. Chronic pain program briefly, and then on the neurolocomotor program, they called it. And so you could be with somebody with a stroke or somebody with some other neurolocomotor condition.
And what drew you to the profession?
Well, I think I was drawn to the profession because mainly it was mental health that I was interested in, and so that's how I started. But that is always a component of any circumstance that a social worker deals with in any case. And the other aspect, of course, was that I wanted to be able to help people. And I unrealistically thought that I could be a bit of a decision maker by being a social worker. So I guess it depends on what system you're part of, but we all know that that isn't always the case. My education was at the Maritime School of Social Work in Halifax. And we had, well, I think we had quite well-rounded education, and we were taught casework at that point, casework. Somebody came and gave us brief lectures, education, I suppose, on group work, but it was basically casework. And this was really a matter of dealing with people in quite a deep way in terms of their feelings. And very seldom in my work later on, certainly at the rehab center, was that the role that I was playing. I was playing a role of helping them to find the resources they were going to need after some type of circumstance, or in the case of the young people, helping them to be involved in groups or some other kind of service that would have helped them. So it really wasn't casework as such.
So the next question is, what was it like to practice in the years prior to the professionalization of social work practice?
Actually, I thought about that question. I don't really think that it was very different for us, because the Association of Social Workers, called the Professional Association at that time, was actually, the Ontario Professional Association, was actually quite active in bringing about the college. And so prior to that, we had a voluntary college. We could voluntarily become part of the college. And those of us who were at the rehab center definitely became part of that if we were qualified, which meant you had to have a master's degree. And so we had educational sessions and prepared ourselves, you know, through those to be well qualified and keep up our educational qualifications.
Mm-hmm. So you didn't necessarily see a difference then? You kind
Well,
of
there was a
always had
difference. There was a difference, but it wasn't necessarily an improvement from our point of view, actually. But it didn't feel like an improvement. We now had a body that would actually be there to protect the public, and that was quite different from what we had before.
Mm-hmm. So is there a social work contribution or accomplishment that you're particularly proud of that you'd like to share?
Well, there's one which was way back when I was at that mental hospital, and the mental hospitals in those days were horrible places for some people. In fact, before the medications came in that helped to medicate them so that they could be part of society again, they were just kept in wards. And there was a group of young boys who were just there in what seemed to me like a cage. It was horrible. And so the young psychologist and I decided that she would test and I would look for a school where these kids could leave the hospital and go to the school. And we were able to do that, and it was a small thing, but it really was something that gave us great satisfaction. And there were other things at a later stage in my career, but that was the first one where I felt I was doing the job of a social worker and helping people in a way that was very satisfying.
Mm-hmm. So giving a boy's opportunity to get an education.
Yeah. There was nothing for them at the hospital, nothing.
Mm-hmm. Given what you know now, is there anything you would do differently in your career if you could go back in time?
I might even choose a different career. I don't really know. I don't know whether there would be anything I would do differently.
So what were some of the challenges or barriers you worked to overcome, and who, if anyone, was your ally?
Well, first I'll say the ally. Ally in the rehab center was right within our own department. We had a wonderful collegial atmosphere. And so we supported each other, and we were supported by our director. And that probably, I don't know if it's still true today, but it has been. Difficulties, I would say that the difficulties we encountered were, of course, the restrictions that were placed on us by being in an agency that had its own parameters in terms of what was possible for an individual social worker to be involved in, such as any social justice activities. But right within our own department, we were able to have our little social justice committee, And we were able to look for situations where clients were being denied the services that they needed, and we were looking at sort of the structural issues. And we were able to take those as actually a satisfying situation where we were able to take that information to our administration, and with that the administration was able to go to a higher level and point out that there were services needed that people from rehab were not receiving. So that was the sort of, I would say that is an example of the sort of thing that we were able to overcome.
What words of wisdom would you like to share with today's social workers?
Well, I think I'm rather out of touch with today's social workers, and if you're talking about a student just graduating, I don't know. Although I just, at our social justice committee last night, we had a young social worker who came and joined us. And I think she's a marvelous addition to our social justice committee. So if she's an example, I have nothing to worry about. However, I doubt that she is really a typical example. She is very interested in social justice issues. And so, of course, I think that that's where I would be suggesting to today's young social workers, look for opportunities if they're not within for social justice work, for advocacy. If it's not within your agency or wherever you're working, you know that you have an organization, the Association of Social Workers, and that we have a social justice committee, and that you can bring any issue to us, and if we can, we will attempt to work on that issue and to get others involved.
Can you tell me a little bit about the Social Justice Committee and what are some of the things you've addressed on behalf of social workers and the clients we serve?
Well, we had been quite involved recently, in the past few years, with the conditions in domiciliary hostels. And these being the residences where people who have various conditions, from mental health issues to being developmentally delayed, and in some cases seniors, when they have been in whatever situation, such as maybe being a street person or being hospitalized for some mental health issue, there is a need to find a place for them to live. And they have to have medication, and their medication has to be provided for them in that situation and administered. So that's what these domiciliary hostels are for. And they're not really intended for people to stay there forever, but that's what happens, and so on, so on. Anyway, we have been looking into those, and we worked with the Carleton School of Social Work, and we had students who took on the task of interviewing clients and some staff and coming up with some rights of the residents, rights for the residents. And we understand that there is this Residents' Bill of Rights now has been posted in all of these residences. So that is one. And at the moment, we're looking at concerns about the inadequacy of the social assistance system. Well, only to say that with this last issue that we're dealing with, that we're right at this moment, that we're in the process of preparing a paper to send to the Ministry of Finance and Economic Affairs regarding, our views on what the government should do, and of course we believe they should increase the social assistance allowances.
Thank you very much, Marg.
You're welcome.